want to thank you all for taking time to join us today to talk about the impact that the Senate budget will have on Ohio's smoke-free law. I'd also like to thank and recognize some of our SmokeFree Ohio steering committee partners that are here with us today as well, from the American Lung Association, from the American Heart Association, and the Ohio State Medical Association. Thank you very much for your partnership. Voters passed the Smoke-Free Workplace Act in November 2006. This was the culmination of a 2-year grassroots campaign by volunteers across the state who are passionate about protecting our right to breathe smoke-free air. In 2006, the Smoke-Free Workplace Act passed with nearly 60% of the vote, and it passed in 87 of Ohio's 88 counties. If you remember, at the same time that voters approved Issue 5, they also soundly defeated a competing ballot issue that would have created a weaker standard for indoor air. Truly, this law means something to the voters of Ohio. They understand what it is and what it does, and they overwhelmingly support this law. In fact, when voters were asked, regardless of how they voted at the time, if they now support or oppose the law, 69% said that they support the law. Across party, age, and gender lines, more voters support the law today than actually voted for the law back in 2006. The Smoke-Free Workplace Act has very high compliance rates. However, a few businesses do continue to test the law. The Ohio Department of Health and local health departments follow up when an employee or a customer complains that a business is permitting smoking. While nearly all Ohio businesses are in compliance, there is still a cost to making sure that businesses are following the law, and we believe that responsibility for enforcement of the law rests with the state like any other law. However, the substitute bill accepted by the Senate Finance Committee on May 31st contains no appropriation for the Ohio Department of Health to maintain its complaint line and enforce the law, and there is no money for local departments of health to follow up on complaints. With no funding for enforcement, follow-up will be lax, and without the threat of fines or penalties, businesses may have no incentive to follow the law. The result will be more employees and customers exposed to secondhand smoke and an uneven playing field for businesses. We believe the people of Ohio, who enacted this law, want it to be enforced like other state laws. Businesses want a fair playing field, and Ohioans want smoke-free air in public places and workplaces. We are asking our state senators to appropriate $1 million each year of the biennium to fund enforcement of the Smoke-Free Workplace Act. And now I'd like to introduce Mr. Len Fisher, a longtime American Cancer Society volunteer and cancer survivor. Len, would you mind joining me?
Well, thank you very much, Marianne, and thank you all for coming today. Well, I've been volunteering for the Cancer Society since 1997, and then after I retired in 1999, the fight against cancer really got into my blood, because the older I got, the more of my friends and relatives began dying of cancer. Probably because I live in Delaware County, I also joined the Delaware County Tobacco-Free Coalition, representing the American Cancer Society. And we all worked very hard to bring about smoke-free ordinances in Powell and in Columbus. Then in 2005-2006, we all joined a wonderful effort to get SmokeFree Ohio on the ballot. Hundreds of us regularly went to public events to gather petition signatures. We went door to door. We spoke at service club meetings. We wrote letters to the editor. And we did a lot of educating about the illnesses that are caused by secondhand smoke. I remember one day I got permission from a drugstore manager to stand up in front of his drugstore to gather signatures. And the guy got out of his car and he came right up to me and got right in my face and just gave me hell for being there and petitioning what I was petitioning. And then he went into the store, he he came out a couple minutes later with a pack of cigarettes in his hand, and he came up to me and he said, you know, I'm really sorry. I shouldn't have said that. And he said, let me sign your petition. And a lot of us who were doing that sort of thing saw those kinds of situations. So as you know, we won. And we won by a large margin, as you just heard. The Smoke-Free Workplace Act has become a reality. And I'm here to tell you, it's become one of the highlights of my entire life. Now, here we are, in 2011. Everybody I talk with enjoys being able to go into businesses and public places and breathe clean, smoke-free air. It's become a genuine right. It's a right. And I can't imagine why anyone would want to go back to risking their health and well-being by weakening the Smoke-Free Workplace Act. And that's exactly what the governor and legislature would be doing if they fail to continue to fund enforcement of the act. They must understand that, mustn't they? I went back and read the entire law last night. It actually requires continued enforcement, public education, and posting of smoke-free signs by the health department. To me, it's unconscionable that our governor and some of our legislators would even consider not funding the enforcement of this popular law that has helped make Ohio a healthy and family-friendly place that it is today. I just don't get it. No one's asking for a lot of money for enforcement and education. We all understand the tough budget decisions that just must be made. And we ask, all we ask, is that the health of every employee and citizen in the Buckeye State be a fair part of the final equation.
Thank you, Glenn, very much. And now I'd like to introduce Shelly Kiser, who is the Director of Advocacy for the American Lung Association of the Midland States. Shelly.
Hi, and thank you all so much for being here today to talk about the dire situation that we're facing regarding enforcement dollars for the Smoke-Free Workplace Act. By this time, I think we all know what voters knew, obviously, back in 2006. And that secondhand smoke is more than just something that bothers some people. It's a serious health hazard that causes heart disease, causes lung cancer, lung diseases, and other forms of cancer. The Smoke-Free Workplace Act was aimed at protecting workers from these dangers, and defunding enforcement of the law could lead to some businesses no longer complying and returning to those practices that put the health of their workers in danger. We know that workers exposed to secondhand smoke in the workplace are 34% more likely to develop lung cancer. We also know that exposure to secondhand smoke at work is significantly associated with all types of respiratory symptoms and asthma. I know from taking phone calls and getting emails at the Lung Association that this law has truly been life-transforming for many of our members with asthma. As our senators debate whether to fund enforcement for this law, we'd ask them to remember that there's no safe level of secondhand smoke. In fact, the U.S. EPA classifies secondhand smoke as a Group A carcinogen. That's a substance known to cause cancer in humans, and it's the same category as radon and asbestos. Again, there's no safe level of exposure to Group A carcinogens. Even low levels of secondhand smoke are dangerous to health. Secondhand smoke is the only source of airborne nicotine and contains more than 4,000 chemicals. And 40 of those chemicals are known to cause cancer. And as a family-friendly state that we are, let's not forget who is impacted by secondhand It's especially dangerous to kids, to the elderly, to people with health problems. Ohio voters said strongly that our health matters to them. So on behalf of all Ohioans, we ask that our senators support adequate funding to enforce the Smoke-Free Workplace Act and keep Ohio healthy and strong.
Thank you, Shelly, and thank you, everyone. Now we'd like to open it up to questions. If anyone has any questions?
Is the idea that the local cuts, local governments, that you're concerned that they might not have enough money to go after and enforce these laws? Is that the deal?
That is part of the concern, yes, because really the law is enforced through, it's complaint driven. And so, yes, you need to have those complaints followed up on, having the enforcement line intact, and then having the dollars so that local health departments have the resources to follow up.
And there are some health departments that said that they would not be able to enforce it without that funding available.
How many? Can you give us an idea?
I don't know that we have an exact number at this time. But of course, there's also, as she said, the funding that is required to have the quit line and the staff at the Ohio Department of Health staff that.
So if this is not funded the way you want it to be, any enforcement would just be sort of anecdotal and happenstance?
It would probably be spotty across the state. I believe there are some health departments that have committed to trying to enforce the law out of their own resources, but we feel that having the law enforced uniformly across the state does help create that even playing field. And we certainly do feel that just like any other law in the state of Ohio, we would expect that state dollars would go toward enforcing it and upholding it.
I think it was Len who said that the law states that the state must enforce the law. So regardless of whether the funding is put into the budget, is the Department of Health still obligated to enforce the law out of its other monies?
I know that the Department of Health is pushing for this as well. Dr. Winslow in his testimony has spoken to the Senate Finance Committee and stated this as one of his priorities to have it enforced. So yeah, I think that is definitely a priority for the health department.
Do you think you'd have legal standing to bring court action against the state if it fails to enforce?
Well, certainly we hope that it doesn't come to any point like that. Actually, it's unclear at this time. I'm not sure. We'd have to look into that. But at this point, we are hoping that this is simply an oversight. As Len said, this is a very tight budget year. There are a lot of competing priorities. And hopefully this will raise some awareness and hopefully get some funding restored.
Was there money for this in the governor's budget or the House passed budget?
No, this has been the same the whole way through. There is $1 million for tobacco in fiscal year 12. However, that funding, according to the budget language, has been designated for the Ohio Tobacco Quit Line, which is also important as well. But enforcement of the Smoke-Free Workplace Act does need to be funded.
So the quit line would get $1 million in 12, but not the other. You also have in your release you want money for the quit line too, I think.
We would like to see that as well. Yes.
We would like to see a comprehensive tobacco prevention program, of course, that would cover many things and keep our smoking rates down, cover youth prevention and things like that. But one vital part of that is obviously the Smoke-Free Ohio.
There's some federal money as well, I think, that's going to the quit line. Do we know how long that's supposed to last?
That I don't know. I would refer you to ODH for that.
And there are federal mandates now that pregnant women are covered for smoking cessation under federal mandates. So there likely will be some money under that. But yeah, I would refer you to talking to them for specific dollar amounts.
What's the prevalence of non-compliance now? You said it's pretty rare. How rare or how common?
It's roughly 98% of compliance, so the non-compliance is fairly low. However, there are those renegade businesses that are not in compliance, and if we know that enforcement is not going to happen, if businesses know that, there will be less incentive for other businesses to follow that law.
You've got a case now before the Ohio Supreme Court, any chance that lack of enforcement on the state's part would undermine your case before the Supreme Court?
I would certainly hope not. And again, we're very optimistic that at this point, we're very optimistic the funding will be restored. Quite frankly, we're not quite sure why the funding for enforcement of the SmokeFree Ohio law hasn't been enforced, and certainly I would encourage you all to put that question to legislators as well.